Hi, everyone. I know folks are still joining us right now, but we're past the hour, so let's just get started. So my name is Glenn Sang. I'm the policy advisor for homelessness and housing at the Department of Healthcare Services. So thank you, everybody, for joining. As many of you are tracking, and this is our Transitional Rent Payment Model All-Comer webinar and Q&A part 2. We previously held a webinar on the transitional rent payment methodology on October 31st. Due to some technical issues, we were unable to answer some questions on transitional rent in real time. Since that webinar, we received some great questions from stakeholders, including managed care plans, county agencies, community supports providers, and other community-based organizations. The slides that we'll present today are the same as the ones that were presented on October 31st. But in our presenting of these slides, we have worked in responses that I'll voice over to some of the questions that we received and really plan to focus on addressing those questions that were raised by you all. So we also will have time to answer questions that may arise during the course of this presentation as well. So all I have to say is before diving in, we, DHCS, want to acknowledge that we understand that there are a lot of details across transitional rent and BHSA, Behavioral Health Services Act, that MCPs, counties, and other stakeholders are working to comprehend and implement. MCPs and counties working together in this space will be an iterative process. So from DHCS's perspective, the most important next step is that contracts between plans and counties get finalized for transitional rent, and that the workflow for referrals and housing support plans is being worked on. So just want to underscore and reiterate that again. I know there's a lot going on, but from our perspective, the most important next steps are those contracting pieces between plans and counties, workflows for referrals, and that housing support plans are being worked on. So that said, let's just get into it. Next slide, please. Okay. So DHCS, as many are aware, we're going to do some level setting. We're preparing to launch the newest community support transitional rent for the behavioral health population of focus in just less than a month. It goes live on 1/1/26, and we're all very excited. And as a reminder, transitional rent will cover up to 6 months of rental assistance for members who are experiencing at risk of homelessness and meet additional eligibility criteria. Notably, transitional rent will be the first mandatory community support service, which MCPs are required to cover for specific populations beginning on Jan 1, 2026. Next slide, please. So the objective for our all-comer webinar today is to discuss the finalized transitional rent payment model that DHCS released in October, respond to questions we received based on the initial overview presented on October 31st, and answer other questions participants may have. So we really appreciate the stakeholder feedback that we received earlier this year and throughout this past year through written feedback and stakeholder engagement sessions, which inform some of the refinements that we made to this final version. So as detailed on this slide, the transitional rent payment methodology document has been posted on a number of DHCS websites. So also in late November, DHCS also released transitional rent supplemental payment technical guidance, an associated FAQ document, and the user acceptance training timeline to MCPs to help support the effective rollout and implementation of transitional rent. Today, along with my colleagues from the Capitated Rates Development Division, we'll provide an overview of the payment structure, the methodology that we used to construct the maximum reimbursement amounts, our reimbursement ceilings, and we'll discuss what can be covered under transitional rent. Again, the webinar slides that we will present today are the same webinar slides that were presented on October 31st webinar for those of you who are joining a second time. And these slides are also posted on the DHCS's Community Supports Resources webpage as well. Next slide, please. Okay, before we get into the actual transitional rent payment methodology discussion, we first want to provide some more opening remarks and a quick overview of key transitional rent policies to, set the foundation and do a little table setting for our audience today. Like I noted, we plan to respond to questions we have received from stakeholders since the last webinar throughout the presentation on the relevant slides, but we'll also hold time at the end of the webinar for a Q&A. Next slide, please. So that said, a little more housekeeping. If you have a question at any point in the presentation, please use the Q&A feature to submit it during the presentation. Our team will be monitoring the questions throughout, and we hope to address some of them at the end of the presentation. I know on October 31st presentation, we had the Q&A function not working well, so we've been working hard to make sure that that function is active and working. So thank you all for joining again for those who did join us on October 31st. Next slide, please. And next slide. So as many of you are aware, and I'd be remiss if I didn't bring this up in any presentation that we do for transitional rents, homelessness, it's a major public health crisis in the United States, and especially here in California. It's estimated that on any given day, there are over 180,000 individuals experiencing homelessness in California. And that is more than a quarter of the nation's unhoused population. So Medi-Cal members who experience homelessness, they have poor health with a high prevalence of Medi-Cal comorbidities as well as behavioral health needs. And as a result of that, we see higher costs and poor health outcomes among unhoused Medi-Cal members. So that all said, these facts have led us to leverage Medicaid authorities that cover housing-related services and bring these services upstream to reach members experiencing homelessness with frequent utilization of institutions and inpatient settings. Next slide, please. With the 2022 launch of ECM Community Supports, DHCS deepened our focus on members experiencing homelessness. And through these efforts, we're really doubling down, and transitional rent builds on that by providing, time-limited benefit designed to prevent adverse health outcomes and serve as the first step in connecting an individual with long-term housing through actual rental assistance. Next slide, please. So this slide, I'm just going to spend a quick beat on it. This is just to show that transitional rent is really part of a broader package of housing-related services for members. And this is just showing, a snapshot of the different services that a member may access, and shows how we're trying to use Medi-Cal to really, fill in some gaps or build along the continuum as well. So services are reaching members at their critical points. Next slide, please. Also to DHCS, we are broadening our housing-related services and supports with the implementation of the Behavioral Health Transformation. The Behavioral Health Services Act, aka DHSA, housing interventions operated by county behavioral health agencies will place and sustain individuals with significant behavioral health needs in housing. In brief, for members who have significant behavioral health needs who meet the eligibility criteria, they can first receive up to 6 months of rental assistance via transitional rent through their Medi-Cal managed care plans. And then following this, DHCS also expects that many members will transition to subsidies provided under BHSA housing interventions. And I should note, for eligible members for BHSA, this will be a viable pathway to long-term housing stability. And I also just want to do one additional plug to encourage people to read the FAQ that DHCS released on BHSA housing interventions and Medi-Cal Community Supports. This resource helps to answer a lot of the common questions stakeholders have about transitional rent and BHSA. Next slide, please. And next slide. So as alluded to on the previous slide, DHCS has strategically decided to launch transitional rent for the behavioral health population of focus on 1/1/26. This slide is the broader eligibility framework for transitional rent. It all starts with the member being enrolled in a Medi-Cal managed care plan, but then also meeting, criteria under each of these three buckets. So like one of the components under each of these three buckets for clinical risk factors, such as meeting access criteria for specialty mental health services, two, social risk factors like experiencing homelessness, and three, also making like a critical life transition, like out of an institutional setting, carceral settings, and others that are listed here as well. So one thing I wanted to clarify, a couple items I wanted to clarify about the eligibility criteria. And this is stemming from questions that we received on the prior webinar on 10/31. First, regarding the at-risk of homelessness eligibility criteria, at this time, transitional rent will not be covering eviction prevention, which is defined in the Community Supports Policy Guide as rental arrears or back rent, or prospective rental assistance for individuals who are housed but at risk of homelessness. So this means that many individuals meeting the definition of at risk of homelessness will not be eligible to receive transitional rent at this time. However, certain individuals at risk of homelessness may still be eligible for transitional rent, provided they meet other eligibility criteria. For example, those exiting a publicly funded institution or system of care that meets HUD's definition and meets HUD's definitions of at risk of homelessness may also be eligible for transitional rent. Second, there has been some question about a person's eligibility for ECM if they are eligible for transitional rent. To clarify, all members who are determined eligible for transitional rent and are not currently receiving ECM, that's our enhanced care management, must be authorized for ECM, regardless of if they meet one of the ECM populations of focus eligibility criteria. Next slide, please. Okay, so how will transitional rent be delivered? This slide is a visual depiction of those involved in the delivery of transitional rent. MCPs must contract with transitional rent providers to administer transitional rent, and MCPs cannot administer payments directly to landlords. As noted, a transitional rent provider is the entity that issues payments for housing for members receiving transitional rent, or will directly provide housing for members receiving transitional rent. In addition to issuing timely payments to landlord and other housing providers, the transitional rent provider plays a key role in ensuring the member is safely and stably housed in an appropriate and habitable setting, and that the member is connected to supportive services providers. So many types of entities can serve as a transitional rent provider. Notably, this includes county agencies such as County Behavioral Health, which are well positioned to serve as transitional rent providers and seamlessly coordinate a BHSA eligible member switch to BHSA housing interventions. We had a question after the first webinar asking, what is the best way for an organization to become a transitional rent provider? Housing providers and other entities that are interested in serving as a transitional rent provider should contact their local managed care plans. Noting that DHCS, we do not maintain a list of contacts that interested entities can contact at each MCP to share with as well. So again, just if you're interested in becoming a provider, please connect with your managed care plan operating in your county. Another question that was asked was if DHCS plans to release a sample transitional rent provider contract, and if there are specific expectations for MCPs in these contracts. The answer is no, we do not plan to release a sample provider contract, but DHCS, we do expect MCPs to adhere to all requirements in the Community Supports Policy Guide as outlined in the Policy Guide Volume 2. Also, as a reminder, DHCS plans to issue referral standards guidance for transitional rent in the housing trio in the coming months. The referral standards guidance will outline DHCS's expectations for referrals to these services and define the information that MCPs must collect as part of the initial referral from referring entities. So again, that the referral standards guidance will be forthcoming in the near future. Next slide, please. Okay, allowable settings. The list on this slide is the full list of allowable settings DHCS will cover for transitional rent. You may immediately notice that some of the settings are featured as both permanent and allowable settings. DHCS defines a permanent setting as one where the member has a renewable lease with a term of at least 1 month. So, for example, a tiny home that does not have a renewable lease agreement would be considered an interim setting, while a tiny home that does have a renewable lease agreement with a term of at least 1 month would be considered a permanent setting. So transitional rent can cover a member's housing in permanent or interim settings, or provide for some months in an interim setting and the remainder in a permanent setting. Permanent housing is our goal for members. However, we understand that housing in an interim setting may be appropriate to provide a member with refuge from the risks of unsheltered homelessness and a launchpad to connect with needed healthcare and social services and work on long-term housing solutions. I do want to address one question that we received from the first webinar that we did, and that was about lease agreements in permanent settings. So the question that we have is, in permanent settings, was if the lease agreement must be in the Medi-Cal member's name, or if it is acceptable for the transitional rent provider to hold a master lease with the landlord and individual leases with members. So this is a great question, and our expectation, DHCS, expects that managed care plans and transitional rent providers work collaboratively with the member and the landlord to determine the most appropriate arrangement for managing the lease while the member is receiving transitional rent and at the expiration of the benefit. Our transitional rent policy does not prescribe a specific lease structure, and both individual leases and master lease models may be used as long as they align with state law, support the member's housing stability, and meet all program requirements. So again, we expect the plan and the providers to work together to identify the most appropriate arrangement. Next slide, please. Okay. Authorization requirements. In addition to meeting the eligibility requirement, a member must have a housing support plan in place in order for an MCP to authorize a member to receive transitional rent. When a member will be placed in the permanent setting through transitional rent, the member must have a comprehensive housing support plan containing all of the required elements, which I will go over in a moment. When a member will be placed in the interim setting, a housing support plan must also be in place, though we recognize it may be less complete given where a member is on their housing journey. So to authorize placement in an interim setting, the plan must confirm the member is BHSA eligible and coordinate with the county behavioral health agency to confirm that the member will be able to transition to BHSA housing interventions at the expiration of transitional rent if the member is otherwise not able to secure long-term rental subsidies. So again, these are highly individualized, and also, there's a lot of focus on BHSA, but also noting that, hey, the member may also be able to secure other long-term rental subsidies or other assistance to continue to be able to pay rent. So a question came up after the last webinar asking if MCPs can require a lease agreement as part of the authorization for transitional rent. The answer is no. MCPs may not require submission of a lease agreement as part of the authorization for transitional rent. Next slide, please. All right, so housing support plan. A member's housing support plan acts as a personalized roadmap to help a member on their journey from homelessness or housing instability into long-term housing stability. So with the upcoming addition of transitional rent, DHCS is further emphasizing the importance of the housing support plan. And as a reminder, the development and maintenance of the housing support plan has always been part of the expectation for members receiving the housing trio services. Now DHCS is doubling down on its importance by requiring a member's housing support plan to be in place in order to authorize transitional rent. This ensures that members receiving transitional rent, which is a time-limited benefit, has a clear and coordinated path toward long-term housing. The required housing support plan can be developed by a community supports provider, a non-Medi-Cal funded supportive services provider, or another type of provider. Whomever develops a housing support plan, it must include some key elements as we described in our policy guide and shown here. And I'll go over that in a second. So finally, the following elements that the housing support plan must include is the permanent housing strategy and solution for the member, including identifying the payment sources and mechanisms that will support the member in maintaining housing after transitional rent is exhausted, and whether that be BHSA housing interventions, the member's own income, other long-term subsidies, that's what we consider to be the permanent housing strategy. That's not exclusive to just BHSA, but could be a member becoming self-sufficient, having their own income, other rental subsidies, or anything else that would show that this member can sustain some permanency. The full range of permanent housing supports that will support member in sustaining tenancy is also included. The plan must also be informed by member preferences and needs, and must be informed by the member preferences and needs, and revised as the member's circumstances change as well. Be based on housing assessment that addresses identified barriers, and the plan also should be developed in a way that is trauma-informed and culturally appropriate. We also received another question about whether DHCS plans to release a housing support plan template. The answer is also no on that as well. We do not. Next slide, please. And next slide. So a little bit of, I'm going to switch us to a little bit of the overview of a transitional rent payment schedule and the background on the transitional rent payment structure. First, we want to provide some basic background information and about how the transitional rent payments will work. DHCS will reimburse the plans for the actual cost of rent or temporary housing up to the reimbursable ceiling established in the payment model. As mentioned previously, the reimbursable ceilings are not fixed rates of payments, and the actual costs of rent or temporary housing will vary case by case. Transitional rent is designed to cover the cost of rent or temporary housing for the member for the full time in which the member is receiving transitional rent, which may be up to 6 months. Plans and providers should prioritize placing members in settings where the transitional rent payment is sufficient, and members must not be required to cover a share of rent. So going back to the October 31st webinar, we received multiple questions about transitional rent in BHSA. First off, as I noted earlier, I would highly encourage people to read the FAQ DHCS released on BHSA housing interventions and Medi-Cal Community Supports. This can be accessed on DHCS's Housing for Health webpage. At a high level, county behavioral health agencies may not use BHSA housing interventions to fund housing-related community supports for a Medi-Cal member who is eligible to receive the same service through their managed care plan. What this means is that BHSA housing interventions cannot be used to cover the cost of housing a member if a member is eligible to receive transitional rent. However, BHSA housing interventions can fund additional services that are not covered by Medi-Cal and may be provided concurrently to a Medi-Cal member who's receiving services from their plan. Again, highly encourage folks to go back and read the FAQ for more information as well too. Next slide, please. So transitional rent will be paid outside of and in addition to usual capitation payments. So there are two components to the transitional rent payment. We'll dig deeper into each component of the rent payment in greater detail in the next section of the presentation, but at a high level, there is the one payment for the actual cost of rent or temporary housing, which can include coverage of certain fees charged as part of the rent payment, specifically the cost of storage fees, amenity fees, and landlord paid utilities. And two, the administrative fee to cover reasonable costs associated with delivering the service. Next slide, please. Okay, so what does transitional rent cover for permanent settings? We're going to step through more information about what transitional rent covers in each setting type. So for permanent settings, the transitional rent payment is designed to cover the full cost of rent and may only be used to cover rental assistance costs, which as mentioned may also include storage fees, amenity fees, and landlord paid utilities that are charged as part of the rent payment. We received a question after the October webinar asking if other funds can be used to fund a gap between the transitional rent reimbursable ceiling and the cost of rent. As I noted, for permanent settings, the transitional rent payment is designed to cover the full cost of rent. MCPs and transitional rent providers should be placing members in settings where the payment provided by the transitional rent provider to the landlord or property owner is sufficient. So there should be no gap. Another question that was asked was if transitional rent can be used to pay the individual's portion of their rent for a member using a housing choice voucher, aka Section 8. If a member is currently receiving a housing choice voucher at this time, transitional rent cannot be used to cover a member's portion of their rent. Per our policy guide, at this time, transitional rent, and I'm quoting, transitional rent may not be used to cover eviction prevention, rent arrears, back rent, or prospective rental assistance for individuals who are housed but at risk of homelessness too. Next slide, please. All right. Next, we'll talk about what transitional rent covers in interim settings. We want to acknowledge that since the final payment model was published, counties have raised questions about what exactly the transitional rent payment covers for interim settings. So DHCS will attempt to provide some clarity during this webinar today, and we also intend to provide more clarity in follow-up to this presentation too. Part of the issue stems from the way counties and other housing providers pay for interim housing, which typically involves a comprehensive all-in bundled per diem rate that also includes room, board, and other services like supportive services such as education, programming, clinical services. So payment for transitional rent for interim settings cover just the cost of housing the member in the interim setting. So another way of saying this is that the payment can cover the room only. Board or food is not included in the transitional rent payment. Similarly, supportive services are not covered under transitional rent, but in many cases can be separately billed to Medi-Cal. Other costs of interim settings that are not considered the cost of housing the member are not covered by transitional rent can be funded through BHSA housing interventions, behavioral health bridge housing funds, or other funding sources if those costs are not separately billable to Medi-Cal. I'll say that again, other costs of interim settings that are not considered the cost of housing the member that are not covered by transitional rent can be funded through BHSA, bridge housing, or other funding sources as available. All right, so I've done a lot of talking, and with this foundational overview of transitional rent, I'm going to pass it over to my colleague, Brian Lewis with our capitated rates development division to describe more about how transitional rent payments will work. So Brian, we'll hand it to you.
Appreciate it. Next slide, please. So now we'll talk or take a closer look at the reimbursable ceilings that DHCS has established for transitional rent. Next slide, please. The reimbursable ceilings have been designed to reflect local rental or occupancy costs of permanent and interim settings across California. We believe the most effective approach to achieve this is by tying the reimbursable ceilings to the small area fair market rent, or SAFMR. We believe doing this aligns the payment standards with the HUD-administered voucher programs, and the methodology ultimately allows for access to housing in higher opportunity areas. The small area fair market rent is established at the zip code level, and it takes account different unit sizes. As you'll see on the next slide, we have all those split out. The final payment model for transitional rent ties the reimbursable ceilings for all settings to small area fair market rent. And one more important note about the ceilings is that they are not the fixed rates of payment. We expect that the actual rent of the temporary housing costs will vary, and that many will fall at or below the reimbursable ceilings. After our October webinar, we received a question about the payment mechanism between DHCS MCPs, as well as between MCPs and downstream providers. So payments to the MCPs will be issued through their regular capitation process. This will be consistent with how other supplemental payments are handled, and we are not directing the MCP how the MCP should reimburse their providers. Next slide, please. So here's a quick review of the reimbursable ceilings for permanent settings. For allowable permanent settings that are not single room occupancy or SRO units, DHCS has established a per month ceiling at 110% of small area fair market rent of the applicable unit size and the number of bedrooms. As a reminder, I know we went over this last time, but we received a lot of feedback around these percentages, some commenting that rates were too high or too low. However, we did receive a fair amount of feedback that the rate was appropriate. And again, to align with HUD voucher standards, we decided to move forward with this 110% rate. For permanent SROs and when tiny homes, recovery housing, or license exempt room and board resemble SROs, the ceiling is set to 82.5% of small area fair market rent. This lower ceiling for SRO and SRO-like settings was applied to align with HUD's lower standards for SROs. And while it's set at less than 100%, we are still paying above the small area fair market rent standard for this setting type. For shared housing, which is defined as 2 or more people living in one rental unit, the ceiling is calculated as a prorated share of 110% of small area fair market rent for the applicable unit size, with the share determined by the number of bedrooms occupied by the member's household relative to the total bedrooms in the unit. So as an example, let's consider there's 3 individuals sharing a 3-bedroom unit, and for that unit, 110% of small area fair market rent is equal to $2,000. Then the prorated share for one individual occupying 1 bedroom, the reimbursable ceiling in that case would be $666. So just a straight proration, 1/3 of the total amount. Also wanted to note that the reimbursable ceilings have been constructed on a per month basis, but the payments can be made on a per diem basis if the stay is less than a full month in any of these instances. For that per diem basis, the reimbursable ceiling for a given setting is equal to the monthly rate divided by 28. Next slide, please. Here's our reimbursable ceilings for interim settings. For allowable interim settings, when a member has their own room, this is inclusive of converted hotel motels, which are now serving individuals experiencing homelessness. DHCS has set the reimbursable ceiling at 110% of the small area fair market rent for the applicable unit size. For interim settings with a small number of individuals per room, the ceiling is calculated as a prorated share of 110% for an efficiency unit, with the share determined by the number of beds in the room occupied by the member's household relative to the total number of beds in the room. So similar structure as the shared housing on the permanent settings. And finally, for hotel motels that are considered commercial lodging and when they are serving as the member's primary residence, DHCS has set the ceiling here as 150% of small area fair market rent for the efficiency units. I'm now going to pass it over to Enrique Zepeda with Capitated Rates Development Division, and he can talk more about the administrative fee component for transitional rent.
Thanks, Brian. As Brian mentioned, my name is Enrique, and I'll discuss more details about the administrative fee component of the transitional rent payment. If we could move on to the next slide, please. And one more. Great, thank you. So the administrative fee is meant to cover the reasonable costs associated with delivering transitional rent across the MCP and the transitional rent provider. DHCS is not prescribing how this fee shall be allocated, given that the division of administrative activities between the MCP and the provider will vary. The department does expect MCPs and transitional rent providers to negotiate rates that really reflect the overall division of responsibilities for each of the parties. Next slide, please. So this slide includes a list of the administrative activities that are meant to be covered through the administrative fee. And really a key distinction of the transitional rent administrative activities is that they are landlord-facing functions compared to the member-facing activities that are covered under housing transition, navigation services, and housing tenancy and sustaining services. Next slide, please. So administrative fee structure, there are two types of administrative fees for transitional rent. The first is the standard administrative fee that is paid on a per month or per diem basis in alignment with how the cost of rent or temporary housing is reimbursed. This is the fee that is paid when a member is placed in an interim setting or after the first month when a member is placed in a permanent setting. The second is the administrative fee for the first month for a member for which a member is placed in a permanent setting. And this payment is consistent with DHCS's goal of advancing long-term housing sustainability and to account for the higher administrative costs associated with these placements. This fee is paid on a per month basis and is only applied in the first month a member receives transitional rent in a permanent setting, and it's worth noting that this higher fee can only be claimed once per member. Next slide, please. So administrative fee schedule, here you'll see both the standard administrative fee and the administrative fee for the first month a member is placed in a permanent setting by region. As noted in the previous slide, the standard administrative fee is paid when a member is placed in an interim setting or after the first month when a member is placed in a permanent setting. These fees are listed per month, and the per diem administrative fee is equal to the applicable monthly rate divided by 28. That concludes this portion on the administrative fees. I'm going to kick it back over to you, Glenn. Thank you.
Thanks, Brian and Enrique. Let's advance the next slide, please. All right, so now we're at the Q&A part of our webinar, and our teams have been looking at the Q&As that you all have submitted through the Q&A function, and then also hopefully we addressed some of the questions that were stemming from the October 31st webinar throughout this presentation as well too. Okay, so first question I have is, what is full service partnership? So California's full service partnership programs are part of the specialty mental health services delivery system. They are recovery-oriented, comprehensive services targeted to individuals who are unhoused or at risk of becoming unhoused and who have a severe mental illness, often with a history of criminal justice involvement and repeat hospitalizations. So generally speaking, this is kind of like an all all-in approach for members as well. I do suggest, though, you talk with your local county behavioral health if you have more questions about full service partnerships. They're the ones who can speak to it better than I can on this webinar. But again, it is part of the specialty mental health services delivery system. Okay, next question. If an MCP is splitting the transitional rent administration fee, where the MCP takes a larger portion, will DHCS step in to regulate? So DHCS, we are not specifying a fixed targeted amount or percentage of this fee that plans should allocate to the transitional rent provider. We do expect that plans and transitional rent providers negotiate rates that are reflective of the administrative costs borne by each of the parties. So again, we're not specifying a fixed targeted amount of the admin fee, but we do expect that plans and providers would, in good faith, negotiate rates that are more reflective of the admin costs borne by each of the parties. I think the third question might be for one of my CRDD colleagues, if you wouldn't mind coming off mute and answering this one.
Hi, Glenn.
Thanks,
Sure.
Glenn.
Oh, go ahead, Brian.
Yes, so the question is, the transitional rent supplemental upload process technical guidance has codes for up to 4 bedrooms. Would we deny transitional rent requests for settings larger than 4 bedrooms? So the transitional rent payment methodology follows the HUD small area fair market rent framework, in which there are different rates for efficiency or studio units, 1 bedroom, 2 bedroom, 3 bedroom, and 4 bedroom. However, this does not mean a setting larger than 4 bedroom must be denied by the managed care plan. The 4 bedroom reimbursable ceiling will be applied for that larger unit in those instances.
Thanks, Brian. Real quick too, I noticed some hands being raised. If you have a question, please pop them in the Q&A function. Again, if you have a question, please pop them in the Q&A function. We will not be addressing raised hands on this webinar. Okay, the next question we received, can transitional rent cover an individual's portion if they are wanting to share a unit with an individual who is paying for their share as well? The short answer is yes. If an individual receiving transitional rent is occupying, for example, 1 bedroom of a 2-unit apartment, then this would be defined as shared housing where 2 or more people live in 1 rental unit. Transitional rent will cover the individual's rent, which is calculated as the prorated share of total rent. Okay, next question I have is, the question is, since transitional rent should be housed in a setting that is appropriate to accommodate the member's family, which may include, for example, a partner or spouse or 1 or more children. If other Medi-Cal members are housed in this unit, does the MCP need to track the utilization under the global cap limit for all members that is covered under this benefit? The answer is yes. The global cap limited 6 months of the service per 5-year demonstration per household. Okay, next question. Does DHCS have any guidance or materials on housing support plans? Specific metrics of what they must include, how to achieve the goals of the housing support plan. So all of our expectations, the way I'll answer that is that all of our expectations for the housing support plans are outlined in section 5 of the Community Supports Policy Guide, volume 2. So again, we try to cover that in detail on these slides, but all of our guidance and materials and expectations around housing support plans, I would refer you back to our Community Supports Policy Guide, volume 2, see section 5. That's really like our source of truth for all things as well. I'll hand it over to my CRDD colleagues to answer the next question too.
Thanks, Glenn. Yeah, we have a couple questions coming through about reimbursement to plans. So again, this is going to come with your regular capitation payments. I believe typically that's through like a EFT method, and it's going to be in line with other supplementals that you currently submit. Also noticing, I think we have some questions related to the supplemental process and the technical guidance that was distributed to plans last week. Please refer back to that email distribution for instructions on how to submit questions in writing. If you don't have that, please reach out to your rate liaison and we can get that package over to you. Sorry, Glenn, I see a couple more just came in. Another question, is the reimbursable ceiling a fixed rate of payment? No, it's not fixed. The reimbursable ceiling represents the maximum amount that can be reimbursed for rent or temporary housing, but it is not the set payment amount. The actual cost of the rent or temporary housing is going to vary from case to case. And we expect that most payments are going to be at or below the reimbursable ceiling amount that we've set. Next question here, how does DHCS ensure equitable access to transitional rent across diverse regions, including rural and high-cost urban areas? Again, this is why we are tied to that HUD small area fair market rent. It varies by zip code and unit size, and is really our best estimate to reflect local housing costs. The administrative fees are also regionally adjusted to account for differences in service and delivery costs. Next question, what is covered by the administrative fee differ from what is covered under the housing-related community supports? So as a reminder, the admin fee is paid to cover the reasonable costs associated with delivering transitional rent services, such as confirming housing settings, coordinating payments, and supporting lease agreements. The activities that are intended to be covered through the admin fee in the delivery of transitional rent are landlord or property owner-facing functions, where HTNS, sorry, I got cut off here. Glenn, I'll kick it back to you for question 10.
Okay. Thanks, Brian. Another question we received. Thank you all for the questions. These are great questions. The question is, my understanding is that the benefit is designed to allow for only 6 months per demonstration period across all plans, given that plans do not get data on what was previously provided to members by other plans. How does the state plan to support MCPs in getting this data so that we know how many months are available to a member within the demonstration period? So as we detailed in the policy guide, we are requiring that plans request information from the prior MCP to obtain information about the room and board service provided and the dates of coverage. Next question we have, the question is, you mentioned that the permanent housing plan on the housing support plan may come from a variety of sources, such as a voucher, members' income, etc. However, slide 15 makes it sound like BHSA eligibility is required. Is this an error that we can correct? So great question, and thanks for raising this up. I was trying to provide a little more clarity on this. Given that on January 1st, 2026, we are going live with the behavioral health population of focus. Nearly all of the individuals that will be eligible for transitional rent under the behavioral health population of focus for transitional rent will also be eligible for BHSA. That said, this does not mean that all individuals receiving transitional rent in a permanent setting will transition to BHSA housing interventions at the expiration of transitional rent. BHSA housing interventions is one of the variety of sources that can be laid out in the individual's housing support plan. But again, there's a variety of other resources that may promote permanency and sustainability and is not solely reliant on BHSA housing interventions, and also would say subject to availability of the BHSA housing intervention dollars too, which is why we're trying to have the plans and counties coordinate this in a seamless fashion. So again, that part's really a head nod to the fact that the behavioral health population of focus is the first to go live on 1/1/26. And then would also just mention that we have not come up, or we have not developed a schedule or a cadence for additional populations of focus to go live as of yet. Brian, I think I'm kicking it over to you for the next one.
Thanks, Glenn. Yeah, question came in, when dividing the monthly rate by 28 for per diem payments, rounding rules may put the monthly rate above the reimbursable ceiling. Should plans round down to ensure that the monthly reimbursable ceiling is not exceeded? Plans will not need to round down in those instances. The way the payment system is set up is the hard cap is going to be the monthly rate. So when processing it, the per diem, it will not exceed the monthly rate for the payment amount.
Thanks, Brian. I'll take the next one. The next question is, are street medicine groups able to utilize these services? So street medicine providers, at a high level can refer individuals to receive transitional rent. I would say, though, it is very important that those street medicine providers who are interfacing with those members living unhoused on the street, really talk with your local managed care plans to coordinate the referral pathways too. Definitely see how the street medicine providers are a strong referring entity. So yeah, please coordinate with your plans. Next question I had, will DHCS referral standard guidelines cover counties that are choosing to use a flex pool as a transitional rent provider? Answer is yes. The referral standards guidance will cover instances where the referring entity is a flex pool. Great question, and thanks for the head nod to flex pools. Next question, is transitional rent available to Medi-Cal members regardless of participating in ECM? Short answer is yes. Transitional rent is available to Medi-Cal members regardless of their participation in ECM. If a Medi-Cal member is determined eligible for transitional rent and the Medi-Cal member is not currently receiving ECM, the MCP must also authorize the member for ECM. The MCP will assign an appropriately selected ECM provider and share all necessary information with the ECM provider to enable the ECM provider to begin conducting in-person outreach visits until the Medi-Cal member chooses to participate in ECM or declines participation. So another question we have, are there specific codes DHCS recommends MCPs and providers use to invoice for administrative fees? DHCS does not have a specific HCPCS code for the admin fee at this time. Multiple plans, I do want to acknowledge that multiple plans have asked if they can use an additional HCPCS modifier to track the transitional rent administrative fee. The answer is that plans may choose to utilize internal coding systems that include an additional HCPCS modifier for the admin fee. So as long as the reporting, once it reaches DHCS, is unaffected. Another way of saying that, it's at the plan discretion as well too. I do want to acknowledge that there is a question about the HUD COC NOFO that came out. The question specifically is, are there any plans to change transitional rent guidance around time limits on interim shelter, no eviction protection, and more based on the federal changes with the COC NOFO, which could lead to the loss of 1,000 PSH units? Curious if the department is open to changes to guidance given that the housing ecosystem is currently being destabilized. The way I'll answer that right now is that, as many of folks are tracking, there are pending lawsuits and litigation surrounding the release of the HUD COC NOFO. Totally recognize like the deep impacts this has to communities and the HUD funding, the impacts it has to the availability of permanent supportive housing supply, especially with the demand we have in California. At this time, it would be premature to change any guidance right now. But that said, we are closely monitoring the pending litigation and also monitoring for any further federal guidance. So at that time, we'll be staying in close contact with a lot of our stakeholders and implementation partners to continue addressing this issue, but just recognizing that there is some pending litigation that we are actively monitoring right now. That all said, we have 2 minutes left. I'm just going to wrap up and then just thank everybody for your time today. So thank you for joining us. We want to sincerely thank you all for your ongoing input and collaboration. We are very excited for the launch of Transitional Rent, which is just in less than a month, coming up on 1/1/26. This is a very exciting resource that we're going to be implementing in California. Also, as part of my wrap up, I just want to note that people can send payment questions to the inbox we have, which is transitional-rent-payments@dhcs.ca.gov. And any policy questions to the Community Supports email address, calayecmilos@dhcs.ca.gov. As a reminder, please check out the Community Supports webpage and the Housing for Health webpage for transitional rent resources, and we look forward to launch. One slight correction, sorry, if folks have questions, please just submit them to the calayecmilos@dhcs.ca.gov inbox, not the previous one I mentioned, sorry about that. And that's the general inbox that we've had for the last few years. So calayecmilos@dhcs.ca.gov. All right, thank you all for your time. Really appreciate it. And again, looking forward to transitional rent being rolled out.